Good morning. So you have come here for your report of findings. So let's get into it. We're going to be talking about basically what we found, what's going on with you. Is this something that we can help with? How long is this going to take? How much is this going to cost? These stack of papers that I just gave you, we're going to discuss that as well. We're going to talk about the benefits and the risk of chiropractic treatment. And let's get into it. So what we found with you is you have lower cross syndrome. That is what we've diagnosed you with. Now this can lead to myalgia and your other symptoms, but I'll tell you this right now, it's something that we do treat here at Cleveland. Lower cross syndrome, first and foremost what it is basically you have weak abdominals and weak glute muscles, and that leads to tight iliopsoas and tight erector muscles, and that can lead to a bunch of dysfunction. So we have to correct that. Do you have any questions? Okay. So what's going on is with your lifting patterns, with just how you move about the world, you've led to these compensatory patterns that leads to you having lower cross syndrome. So when you're squatting, and especially once you get fatigued, you can't rely on that pattern, and those symptoms may present, which most of the time is going to be with pain. So how are we going to fix that? As I mentioned before earlier, yes, we treat that. So we will treat that with multiple ways. We don't just use one way. One way is going to be with HVLA, which is high velocity, low amplitude adjustments, basically adjusting with our hands. And that's for the structural component. Now, with the muscular component, the soft tissue, we have exercises that's here in that packet that we just gave you. So you'll have your own homework, which you'll have to do these exercises every day, and do these stretches before you do workouts. And we're going to be working on restructuring and changing a lot of that forms. Are there any questions with that? Okay, so we went with the approach of seeing you 2 times a day for 6 weeks. Now that ends up being for a total of 12 visits, which can seem like a lot, but we do need to have, since this took a long time of happening for these patterns to occur, you being 24 years old, we need to be able to monitor and risk over a period of time to see how long are we getting better? Is our treatment getting better, and is it being consistent? We don't want to just do a quick fix, send you home, and have you just have the same problems again. So we have to make sure that we have a progression of special workouts given to you here, as you see the dead bug and the bird dog as well. Are there any questions with that? Good. So as you see in your hand, there's EPSS report. So basically this is a quality agency for healthcare and research, and basically on your demographics, your age, your gender, your lifestyle, that we went over, the information that I got from your new patient exam. It will show potential infections, risk factors that you qualify for, and something that you should definitely consider. And next time you get to your personal care physician, definitely take this with you and have any questions. Or if you have any questions with me after reviewing that, please ask. So at that point, do you have any questions? Okay, thank you. So I have to tell you about other treatments. So you can see your personal care physician about the symptoms that you currently have. You could also see a orthopedic surgeon, get a consultation there as well. You could go get a massage therapy for the lower back pain that you may be having. You can see a physical therapist, which they're going to be going over these movement patterns and making sure that they find that stability with you, because lower cross syndrome does have an instability issue, which is why you may be having some of those cares. So I would recommend that as well. Do you have any questions? Oh, sorry. Actually, before I jump into that, you don't have to do anything. Depending on the pain, whatever brought you into this office, if you can live with that, then there's really nothing to further address. So you do not have to get treatment. And I do need to let you know that you do not have to get chiropractic treatment. You do not have to get any treatment. And just see how that treats you the next following couple weeks or months, or if you can deal with the pain. So there are benefits of chiropractic care, so or else this profession wouldn't exist. So there's pain reduction, more energy, you get better sleep, improved quality of life. We like to think of chiropractic as a means to optimize your health. So that can mean for assorted things. If you have with your daily active living activities, you mowing the lawn, you mentioned that earlier, you just doing yard work and being able to be outside and help run the house longer, more effectively, without any pain, or you being able to be in the gym and squatting, you be able to squat without having any pain. That's an improvement of quality of life right there. But there are risks to chiropractic care. We are moving structures within the body, and so that can lead to inflammation. That can lead to, and inflammation is pain. So you could be sore after a chiropractic adjustment. That's not out of the ordinary. Sometimes what is more out of the ordinary is, especially in the mid-back region where your ribs are, you can have broken ribs if there's an improper adjustment. If we're using any improper techniques and you're getting too far out. Our school has taken many precautions to ensure that does not happen, and actually we are limited to the amount of techniques that we can do so that doesn't happen, and that dives right into our stroke protocol as well. There have been cases that there have been patients who have stroke after a cervical or manipulation or a neck manipulation. Typically that's used with rotary movements, which are prohibited here at Cleveland, but it is something that I do have to tell you about, so you are aware about the risk. All these are minimal risk, but again, if they're very serious, it really depends on the demographic. For instance, people that have strokes, there's been a lot of investigations to show and prove that person was already undergoing stroke or at high risk for having a stroke before they even stepped into the office, which you do not follow underneath that category. So something we do need to talk about, though, before we even get into treatment, is goals. We know that we want to reduce the pain in your lower back immediately, but we also know that you want to be able to squat heavy and be able to re-rack that weight without having any pain. And so we need to have a timeline on that, and I think that we can get there at least halfway. So at the 3-week mark, being able for you to go into a gym, do any type of workouts the way you've been doing them, doing the same load, doing the same reps, and being able to leave that gym without having those symptoms that brought you into here in the first place. That's a goal. And then also another goal is for you to be able to bend over for a longer periods of time without experiencing your symptoms. You said you've been bending over 30 minutes to 45 minutes at a time working on things. Last time it was your AC unit, and I think that would be a reasonable goal to be able to kind of encase that in with the previous one. So, do you have any questions? Good. So, the last thing is we need your consent. We are happy you're consenting to chiropractic care here at Cleveland, and you need to sign these papers, and please review the paperwork thoroughly. Ask any questions that you may have. If anything sounds fishy, if something sounds off, anything that is unclear, please ask a question. not even just me, any of the clinicians here, if you aren't comfortable talking to me about. So anyways, that concludes the report of findings. Thank you so much for listening.